Hi, Dave with Align Therapy here. One of the big things that we treat here at Align Therapy is back pain and knee pain. Knee pain is something that's really prevalent and happens in runners, happens in just anyone that's being active. And one of the big things, if you've been treated for knee pain, especially in the last 5 years, you probably know that we focus a lot on hip strengthening. The hip is kind of the key to treating the knee. Back 20 years ago wasn't really the case. A lot of the research now that comes out shows that strengthening the hip affects the knee a lot. So I wanted to describe why that is. Why is knee pain so correlated with hip weakness, and why we want to strengthen the hip? So first of all, to know why we strengthen the hip, you have to know kind of why knee pain happens. So the knee is a hinge, so it just flexes and extends. That's all it does, just back and forth. Most of the time with knee pain happens because of a rotation or an instability in this direction of the knee. It's usually not because something's going on this way. Sometimes it can be, like tendonitis and muscle soreness and stuff like that. But a lot of times it's because of the rotation. That rotation of the knee going in and out like this happens at the hip. So if your hip is strong and stable, then your knee doesn't rotate in or out. It stays in line with your foot. So when you're doing things like a single leg squat, if your knee is going straight in line with your hip and your ankle, there's less stress going side to side. So that's why we focus so much on the hip, is to stabilize the knee as it's bending and being used. So one of the big things that we treat is called patellofemoral pain. It's pain where the kneecap meets the femur. So the kneecap sits in a groove like this and goes back and forth on the femur. If the kneecap is tracking abnormally, so to one side or the other too much, then it creates pain and irritation on that side of the knee joint. So classic signs with that is pain around the kneecap, going downstairs, going upstairs, squatting, things like that, pain that's centered around the kneecap. It used to be thought that we needed to strengthen what's called the VMO, this muscle here on the inside of the knee, to help pull the kneecap to the inside. But what we're finding more and more is that the hip plays a bigger role in that. So as you're doing something where the knee is bending, if the knee is going to the inside, the kneecap is being pulled to the outside, which puts more pressure on the outside of the femur. So the way we control that is we control the hip. We control the hip's ability to stabilize what the knee is doing when it's bending. So hopefully that helps you to understand a little bit more why we're focusing on the hip. I have patients all the time that ask me, why are we doing so much with the hip when it's my knee that hurts? Or sometimes they'll come in and be like, oh, I just need to strengthen my hips again, because we do that for a lot of different problems. Now, if you're having knee pain and you don't quite know what to do about it, or you want some help with it, we'd love to help you. So thanks for watching the video, and subscribe to learn more. Thanks.